and thank you for joining us for the Ministry of Health virtual media conference on the national COVID-19 response for Wednesday, 23rd February 2022. Our panelists today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, and we have Dr. Joanne Paul, Senior Pediatric Emergency Medicine Specialist at the North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Senior Corporate Communications Officer in the Ministry of Health, and I will be the moderator for this morning's conference. We begin with the latest clinical and vaccination update by Dr. Parasram.
Hi, good morning, Mr. Alexander. Good morning to the Honorable Minister. Good morning to Dr. Paul, members of the media, members of the viewing and listening public. So we begin with the dashboard. If I can have the dashboard as of yesterday, which is the 22nd of February 2022. I will skip over the portion with the population vaccination status as the Honorable Minister will go into those details. So beginning with the new positive cases, over the last 24 hours we would have had 412. And just to remind you, rolling average at this point is 460 cases over the last 7 days. In terms of deaths, we reported 8 yesterday, and condolences to the families of all of those who would have lost loved ones during this time. And again, the death rolling average for 7 days is now standing at 7. Total active positive cases, 20,830. Total patients in hospital, both hospital and step down, 332. Of that, 262 are in hospital and the remainder are in step down. Total deaths, again by vaccination status, if we look at the bottom graph, we see the majority of those deaths would have occurred in persons that were not fully vaccinated at the time of death. 2,924, the blue bit on the graph below, and 230 with fully vaccinated status. Patients by vaccination status in the hospital, July 22nd to February 2nd, fully vaccinated 2,543 versus not fully vaccinated 12,860. Therefore, 83.5% of those would have not been fully vaccinated during their hospital stay. I think that brings me to the end of my brief presentation this morning. Mr. Alexander. Thank you.
Thank you very much, CMO. We welcome back Dr. Paul, who will present some very important information on children with COVID-19. She will also update us on the number of missing cases currently present at the nation's health institutions. Dr. Paul. Morning.
Thank you very much, Honorable Minister, Chief Medical Officer, Mr. Al Alexander, ladies and gentlemen, members of the media. Thanks for inviting me again to discuss with you guys about the updates with regards to COVID-19 in children. So in terms of, if we can start the presentation, please. Start the PowerPoint, that'll be great. As we wait to start it, I'll just go through. All right. So we have, in terms of the PowerPoint, which is coming soon, we have the amount of admissions to hospitals so far since we started the pandemic. In terms of children, it's 342. So we have 342 admissions in total to the parallel health system. So I'm just doing the numbers update for you guys. All right, in terms of the amount of children who are actually in hospital right now, we have 5. We have 1 1-month-old, a 2-month-old, 8-year-old, 12-year-old, and also a 2-year-old. So we have 5 children presently in the parallel healthcare system. Now, we have seen a trend in terms of in 2020 and 2021, we had mostly those cases with primary COVID and also COVID-related. Our trend so far this year is now changing a bit into 2 groups. We have the ones who are severely sick or very sick, and that's the ones who are the babies. So we have the babies who are less than 1 year. They're the ones, if they get COVID, they're the ones who we have in the ICU and HDU. And also we have the ones with the chronic medical conditions. So we have the ones who are, for instance, renal, kidney disease, heart disease, diabetes, even thyroid, immune issues, and also obesity. So we have that group. In terms of the vulnerable groups, they're the ones who, when they get COVID, they're very ill with COVID, even with Omicron, and they're in hospital. The other group now, in terms of the primary, is no longer primary COVID, is actually where it's incidental COVID. So for the rest of the children, not in the vulnerable groups, you have it where they are mostly no symptoms whatsoever. So if they have COVID, they'll have something else. So they come to hospital with some other diagnosis and they have COVID as secondary. So it used to be, again, the past 2 years where it was primary COVID, you had COVID or COVID related. Now it's shifting to those who are two groups. Either you're going to be very sick because you have chronic conditions, or you're not symptomatic for COVID and you have incidental COVID. All right, next slide, please. As we go through in terms of the actual mortality now, we're looking at 12 deaths so far. So I'm giving you all the figures. So we have the total admissions, 342. The amount of deaths we've had under 18 years old is 12. 11 of them are under 16 years old, and one was a 17-year-old. The majority, as I said before, is bimodal distribution. So it's been the ones, the babies again, and the adolescents who are above 12 years old, who have extra chronic medical illnesses, especially complex ones per se. And the trend in terms of when I spoke to a few of the pediatric leads yesterday, they mentioned that a few of the patients, the parents, are still coming in too late, especially those with those medical conditions. So not only are they not being as aware that they can get really seriously ill with that, they're coming in a bit later. So when they come into the parallel health system, they're a bit sicker than they would be usually. Next slide, please. So this is my most important slide, and it took a fair amount of data collection yesterday, and I wanted to show the population really of where we're at. Of course, you want to show what you're doing, and you also want to compare to international standards. If you look at it, for instance, this is what, so UNICEF actually, you can't really compare in terms of mortality figures. It's difficult to compare it to admission figures because different countries have different admission criteria. So what UNICEF does, it compares the percentage mortality to the overall amount of deaths. And it's really a percentage thereof. So therefore, you're able to see how the performance has been for the country with regards to COVID deaths in children. And what we've found is that the average, the international average, is 0.4%. The Trinidad average is 0.3%. And of course, if you look at the big one on top, Singapore is less than 1%. So I've chosen a few countries where they have a maybe similar size or slightly similar size, or they have a very similar ethnic composition. And also, of course, South Africa is very similar to our ethnic composition, although it's a bigger country. And I've included some of the Caribbean islands. So significantly, in terms of our pediatric mortality, we're less than the international standard by UNICEF for the entire world. And we haven't reached Singapore levels yet, but 0.3 is where we're at right now. Next slide, please. In terms of Miss C updates, again, we're looking at the update from Dr. Ronan Ramrup, who is our pediatric cardiologist in Trinidad, our main one, and he's the one who's been mainly watching over these Miss C cases, and we have 76 cases so far. And I also had to get feedback, of course, in the rest of the Caribbean yesterday, and we're still the highest amount of Miss C. But significantly, we haven't had any deaths from Miss C at all. So the thing about Miss C, we have had a lull in December and late November, but it's coming up in January again. So what we found in terms of the trends, we found that it's about now 4 weeks after any peak in terms of COVID spike of cases generally in the community in Trinidad. So we have the adult numbers going up. About 4 weeks afterwards, we're seeing the Miss C numbers going up. But there are a few significant things about that. Number one is that we're not only seeing Miss C coming up, but we have now the post-COVID brain inflammation or encephalitis. So we're seeing, again, about 4 weeks afterwards, we're seeing an increase in those numbers. I already mentioned before that with COVID, it can have receptors and it can attack the brain, the heart, and also the GI and other places. So we're seeing that now in terms of brain. So typically now we're seeing after that, that spike in terms of cases. We're seeing MIS-C and also brain issues in terms of children, encephalitis, where they're presenting with that post-COVID. A few significant things about MIS-C, though, is that one, the children who are having MIS-C are usually having no symptoms. So usually when they have MIS-C, the parents are saying, well, they didn't realize that they were COVID positive. So the thing is that they have no symptoms, and then afterwards they present with MIS-C. So you really have to be watching out for the MIS-C signs and also the signs of the encephalitis, where they might be a little bit drowsy, lethargic, irritable, and they might have seizures. The other significant point about MIS-C is that aside from one who was unvaccinated, but no vaccinated patient between the ages of 12 and 17 developed MIS-C. So far, since August last year, since we started to have vaccinations for that age group, none of those patients have developed MIS-C at all. And it's a similar trend with regards to the post-COVID encephalitis. So we're seeing MIS-C, we're seeing the vaccination having a drastic and significant effect on MIS-C per se. So the most of the MIS-C cases have been on the age group less than 12, where they haven't had a vaccination yet, and also the unvaccinated case. We've had one so far since August who has been MIS-C, but so far, if you've had your vaccine in children, there's no case we've had with MIS-C after they've had their vaccination. Next slide, please. So in terms of just a micro summary, so we can appreciate the landscape. So we're looking at like three groups per se. We're seeing that if you have your chronic medical conditions, sickle cell, diabetes, hypertension, obesity also, those ones are really super at risk of having severe COVID. If you have your babies less than 1 year old, again, they're at risk of having severe COVID. The rest of the group in terms of pediatrics, they usually have asymptomatic. But in that group, they're the ones who are prone to MIS-C and the post-COVID encephalitis 4 weeks afterwards. And so as parents of any age group, I think we have to be aware of what we should do. So for instance, if your child belongs in that vulnerable age group, that vulnerable group of sickle cell, any medical condition where they have to see a specialist for, my advice is to get them vaccinated. That's the group that's in the ICU having severe COVID, and that's the group who are having the mortality. So have those ones vaccinated. If, for instance, your child is less than 1 year old, as a parent, I would advise that you yourself make sure you get vaccinated and make sure you breastfeed your child while your infant. And therefore, you're transferring all those wonderful antibodies from the vaccination to your less than 1 year old to protect them against COVID. So it's really important for those two age groups. In terms of the other age groups, in terms of all the others who have no medical conditions, I would still say you don't want to have that child get MIS-C or post-COVID encephalitis. And we have seen a drastic response with that. So we're saying also have those children vaccinated. Okay? Next slide, please. So the other advice for parents and guardians is that generally as we migrate back to schools, as we know, we have secondary schools started and we also have the C students, and in April we should have the primary schools opening. As we're preparing for schools, and at some point in time we'll have preschool started. As we're preparing for schools, the same way how when you're preparing you have a tick sheet, a checklist. So you have it where you go through and you say uniforms, tick. I have my school books, tick. Be vaccine ready, tick. Because of course, to start schools, you have to have your child vaccinated with MMR and DPT. You have to have your vaccines updated. So I will say have your vaccine check also for your children before they start their preschool or before they start their primary school. Make sure you cover them, and you have to do it before the school anyway, so to make sure that's on your list. When I spoke to the EPI person in charge, what they detail is that we're having now at some areas the nurses are actually coming out to you if you can't come out to them in your health center, because we want to make sure there's a general protection all over. So we're talking about having it vaccine ready before you go to school. Make sure you get your vaccine on with your child. So in summary, a few things to note. Generally, COVID-19 is milder in children, for sure, especially with Omicron. But there's a big but. We have the ones who are the younger, the babies who are the ones who are having severe COVID. We have the ones who have the medical conditions, who are the vulnerable groups who have severe COVID, and they're the ones who have been having the mortality so far. We're looking at, in terms of the MIS-C, we're seeing that there's been a high increasing amount so far in January and February with regards to MIS-C and also post-COVID encephalitis. But the key thing with that, no, and I repeat that again, no patient who has had their vaccination has had MIS-C since August, since we started our vaccination with our children with that adolescent age group. It's been nothing with MIS-C. So MIS-C and vaccines are having a definite impact right there. With regards to, as I mentioned about the preparation for school, be vaccine ready. But last but not least is that our child mortality rate in Trinidad is below international standards. So there are three things I look at. There's one, appreciation. I would like to appreciate the pediatric teams. They have been really working hard for this pandemic, and they've been trying to keep this mortality reduced. Also, Dr. Ronan Ramrup, who's really been the person who you'll just call out anytime to do any scan for your child with MIS-C, and he is there available to make sure that this group is catered for. The second one is also improvement. You want to have it where you appreciate what you have, but you also strive for improvement. My goal is actually to have it where we go to Singapore levels, where we're less than 0.1%. That's the ultimate goal. So I want to have it where, as we monitor the situation, which is my third point, as we look through in terms of the next few months and see what's happening, we have to be agile, of course, because we're still, with the pandemic, we've been up and down, and we're looking and we're learning as we go along, making sure we modify things to suit. I think the major thing right now is to also we need the parents and guardians to do their part in this as we try to reduce our mortality to even way less to Singapore levels. So I'm talking about vaccination. I'm talking about being aware of the signs and symptoms of MIS-C and also post-COVID, coming early to hospital and just having the information at your fingertips, but also being vaccine ready for school. They play your part in this entire pandemic. And actually, I thank you very much. Also, I show appreciation to all of you guys who have been doing the same. Thank you.
And thank you very much, Dr. Paul. We close off this morning's presentations with the Honorable Terence Dial Singh, who will present the latest vaccination figures.
Thank you very much, Al. Good morning to the Chief Medical Officer. And thank you, Dr. Paul, for that excellent presentation as to bring the country up to date on MIS-C. And I think the big takeaway for me are two things. One, the dedication of Dr. Ronan Ramrup, yourself, Dr. Choya, everyone else who has been doing yeoman service. That's takeaway number one. But takeaway number two, ladies and gentlemen, is the fact that Dr. Paul said that since we started vaccinating that adolescent group 12 to 18 in August, we have had no MIS-C cases in that group. And we want to do even more. So the vaccination figures are like this. As of yesterday, 701,372 persons are considered fully vaccinated, which is about 50.1% of the population. 131,890 persons are boosted. Again, a decent place to be, but we could do better. The number of public servants accessing vaccines since January 3rd at the specialized sites. It doesn't mean that they're not accessing vaccines at the other sites, but just those two sites, 2,551. And the school outreach, which we started on Monday, actually going into selected schools between Monday and Tuesday, has yielded a grand total of 14. That is pathetically low. And I want to urge parents to take advantage of the fact that you now have, again, clinical data that shows that vaccinations in that 12 to 18 age group works. It prevents your children from getting missy. And as Dr. Paul said, the message is many of these children are asymptomatic, do not know that they have missy. They are asymptomatic, and then when they present with swelling of the brain. And so let's avoid those things, and let's be proactive by taking advantage of the fact we are now in schools, selected schools chosen by both the Ministry of Education, and we are coming to you. Let's save our 12 to 18 cohort, and that's my plea this morning. And Al, we have a lot of time now for questions. Thank you.
Thank you very much, Minister. And we will then move to the question and answer segment. We ask the media representatives to state their name and the name of their media house before posing their questions. We are requesting 2 questions maximum per media house in the first instance, after which we will field additional questions from the media representatives as time permits. During this segment also, we'll be facilitating a few questions submitted by the Media Association of Trinidad on behalf of their members. Our first question goes to azpnews.com. Good morning.
Hi, good morning. Private Harry, azpnews.com. Are you hearing me?
Yes, we are.
Yeah. Okay. My first question is for Dr. Paul. Dr. Paul, when a child is positive for COVID-19, if his symptoms are mild, should he still seek medical help? Should the parents still, for example, go to a doctor or go to a clinic for him? One. And my second question, maybe to the minister. Minister, I think Dr. Paul may have let the cat out of the bag, saying that you're aiming to open schools in April. What factors are going to play into that? At this point in time, can you safely say that after the Easter holidays, schools, primary schools, could be opened? Thank you.
So I'll take the second question. So the Minister of Health does not open schools. All decisions regarding schools opening will be announced by the Minister of Education after consulting with the Honorable Prime Minister. And the Minister of Education has made no secret of the fact that schools will be open in a gradual basis. Okay? Thank you.
Dr. Paul?
Hi, Prior. Thanks for that question. So if you have your child positive for COVID, if you have mild symptoms, I think we had mentioned this before, just make sure you have your little pack in terms of your paracetamol, your ibuprofen, lots of fluids, and monitor them for any signs and symptoms in terms of, we mentioned about having croup signs, upper respiratory, looking for dehydration if they're having any diarrhea or vomiting. But you don't necessarily have to take them to see a doctor. You yourself, as a parent, you're the advocate, you're the mini nurse, you're the mini doctor. You can watch them. We also mentioned about having your checkpoint in terms of having your person to talk to, your nurse or your doctor, in terms of your doctor friend, just to check and say, here what, my child is like this, and just monitoring with them on a daily basis. But as they have mild symptoms, just watch them carefully, optimize the fluids. If though, as the minister already mentioned, if you find that you're seeing signs otherwise, where they're a bit drowsy, irritable, you find their heart is beating a bit faster or slower, they're not being quite themselves, or they're looking a bit off color. Therefore, what you can do at that point in time, feel free to go to any of the facilities. They are quite available. We have all the staff there really aware of what can be done in terms of the emergency service, emergency departments. So feel free, do not have your child who's deteriorating at home. Make sure if they're mild, you can handle and monitor. And if they're becoming more severe, let someone check. And when you do, I always make sure and tell parents this, when you do go to that health facility, make sure you leave that you're happy, you understand what they've told you, what the diagnosis is, you agree with it, and you're happy your child is going to get better. If you have any issues whatsoever, make sure you tell them, I'm not happy, I want something else done, or I want to make sure I'm engaged. So don't just go there and just leave if you're not happy. Go, make sure you're engaged with the process, you know what's happening with your child. This is your child. Thank you very much.
Thank you very much, Dr. Paul, for that information. With that, we go to 103 FM.
Hi, good morning, everyone. Rai Rikomas from 103.1 FM. There have been questions, especially after the announcement of the removal for the time restrictions on beaches, about the mask mandate in private vehicles when that vehicle is occupied by more than one person. Persons are asking if it's time now to remove said requirement. I'm just looking for the health ministry's perspective on this and the rationale for its current position. And to Dr. Paul, how many cases of this post-COVID brain issue have been confirmed here in TNT, and what's the prevalence of it?
Okay, thank you very much. I'll take the first question on the mask mandate. Yes, that is a mandate for traveling in vehicles. The rationale is as follows. Vehicles, especially air-conditioned vehicles, where you don't have air circulating with unmasked people, is a danger to both spreading COVID and contracting COVID. That applies to whether you're in a private vehicle or a public vehicle. So the rationale is one of preventing spread, containing the virus, especially as most vehicles are air conditioned and you are in close contact with no circulating air. And as we know, as all the public health experts will tell you, fresh, breezy air is one of the things that you need out in the outdoor setting to decrease levels of COVID, and that is not available in an air-conditioned car, whether it's public or private. Thank you very much.
Thank you for that question. So far since January, we've had about 3 or 4 of those cases in terms of the post-COVID encephalitis coming through. I'll check my numbers for last year in terms of 2021 and 2020, but we had a few last year, but we're now seeing a clear trend. So we had it really in between last year, but now we're seeing a clear trend. Right, 4 weeks afterwards, it's just having a spike up, and it's really mimicking the MISI trend. So I'll get the numbers for the minister and the CMO for next time. But so far, since the year started, we've had about 3 or 4 of those cases. Thank you.
Thank you very much, Dr. Paul. And with that, we go to Newsday. We'll take 2 questions from Newsday.
Hi, good morning. Clint Chantok of Newsday. My first question is I wanted to get an idea as to what is the status of the digital card vaccination implementation. We haven't heard anything on that for a while, and we're kind of curious as to if there's any particular challenges and with that and when it'll get unrolling. And in the same breath, same thing for an update for the public sector safe zone legislation. And the other question I had is, since the COVID-19 committee's report has come out, where are we now in terms of rolling out the various recommendations that you have there, and if there are any concerns of the continued complaints coming from certain quarters, such as the opposition, as to certain other types of action that should be taken, and seemingly not being satisfied with the recommendations being advanced from the committee. Thanks.
Thank you. So I'll take 3 questions. I hope I remember all 3. On the e-vaccination card, I spoke with Minister Bacchus yesterday. We are completing the verification exercise, and as soon as that is finished, Minister Bacchus will advise me when we are to roll out. What was the second question, Clint? The safe zone, sorry. The policy for public service. Yeah. So, Clint, as you know, the Honorable Attorney General has been speaking publicly about that. That is a legislative matter that is under the remit of the Attorney General, and he has made 2 public statements on that. 3, you asked about the opposition's response to the... You want to repeat the third question about the opposition's response to the Simongal report, Clint?
does it in terms of the rollout?
In terms of the rollout?
Yes.
Yeah.
Yeah, well, the first part of that is, I mean, now that the committee has given its recommendations in that report, where are we in terms of rolling out those recommendations? And then the view as well that, and attached to that is the view as well that while the report has been made, the recommendations have been made, you still have parties like people like the opposition and others who are not satisfied with that and still think that there should be some other type of legal or other type of action that should be taken.
Thank you. Yes, Clint. So, on Saturday, when we had the first press conference after the report was made public, you may recall I did say I found that the report was a very balanced report that gave the whole spectrum of responses from things that we did excellently well, things that we did very well, and areas of concern. Some of the areas of concern are around that the fact that we could do better with data collection, data management. And as I indicated on Saturday, we do have a national health information program that was slowed down because of COVID, and we are accelerating that now. Some of the recommendations have to do with operational issues at the RHAs. The CEOs have the reports. I met with them yesterday. So things like staff accommodation, burnout, meals for staff, and so on. Those are very important recommendations that we could look at almost immediately. So the operational issues at the level of the RHAs, we are concerned about it. And in a report like this, whilst you accept the good, you really have to focus on your deficiencies. And these deficiencies really showed up at the height of the pandemic, which is when systems are most strained. So we are grateful for the report. On the opposition, it is difficult to fathom the opposition's opposition to the report because you see, Clint, the opposition made two very unfortunate statements before the report came in. And that is why you can never take anything that the opposition says seriously. UNC, I'm quoting from an online article here. UNC MP slams sham probe into healthcare system. So if the report, which they presuppose was a sham report, on what basis, are they talking about now? I found the report was very balanced. It gave the whole spectrum of things that did very well to things that we could improve on. And then the opposition again here. Opposition leader Kamla Prasad-Bissessar has dismissed the recently announced review of COVID-19 care as a pappy show. So it is always very difficult to see the opposition ill-speaking public officers, whether it's the CMO, Dr. Trotman, Dr. Hines, and attacking public servants, and then they attacked the committee even before they started to meet. So it's very, very difficult to take the opposition seriously, but I take the findings of the report very seriously. Thank you very much, Clint.
And thank you very much, Minister. With that, we go to the Express. Ms. Hunt, good morning.
Good morning, Camille Hunt, Express. Minister Dayal Singh, there are several safe zone venues, including restaurants that are advertising carnival events. They're selling tickets, advertising performances, and so on. So I wanted to get some clarity on if these types of events are allowed under the safe zone guidelines. Thank you.
So the management of the safe zone guidelines and the implementation and the overseeing of the safe zone guidelines are the remit of the TTPS, the Ministry of Health, in conjunction with the Attorney General and approved by Cabinet. We put out guidelines, we put out the conditions. If anyone has any problem with any private entity or anybody violating the terms of the safe zone, please send it to the TTPS, and they are the responsible party for enforcing the legislation. Okay? Thank you.
Thank you very much, Minister. And with that, we go to TV6. We're ready for your two questions.
Morning, everyone. Urvashi from TV6. In light of Dr. Paul's presentation this morning, she was certainly urging vaccination and so on. Minister, can you give us an update as to the status of the acquisition of vaccines for those under 12? And secondly, Chief Medical Officer Dr. Parasram, we saw that the WHO, they would have issued a statement on the Omicron sublineage BA.2. Your thoughts on the threat of this particular sublineage and any additional precautions should we be afraid? Is it more severe than the traditional Omicron variant and so on? Your thoughts on this? Thank you.
Thank you very much, Urvashi. So the acquisition of vaccines for the 5 to 11 age group, as we have been saying for some weeks now, we started that process in early January or December in bilateral talks with Pfizer and also via a CARICOM agreement via CARPHA. Up to this morning, CMO, was it this morning? We sent a letter to the... No, that was something else. Yeah. So we are always in talks. We had talks with Pfizer up to 2 weeks ago. I remember that one, yeah. And also CARPHA is working on a CARICOM initiative for the whole of CARICOM. We have no firm date as yet. As far as the bilateral talks are concerned, in which I was a party to, Pfizer indicated a couple of weeks ago when we last met with them bilaterally that they have to send something called a heads of terms agreement to us. We are still awaiting that. A heads of terms agreement is a precursor to an actual contract. So we can't move forward until we get the actual heads of terms agreement and then go to the contractual phase for the bilateral part. But CARPHA is also working simultaneously on the CARICOM initiative. Okay? Thank you very much, Urvashi. CMO?
Yeah. So thank you for the question. So yesterday, actually, WHO's Technical Advisory Group on SARS-CoV would have met and issued a statement on this particular sublineage. So the group reinforced that BA2 is a sublineage and should continue to be considered a variant of concern, and it should still be classified as Omicron on the face of it. So we're talking about a sublineage of Omicron, which we actually have as our most dominant variant in the country. So we're treating it as such. In terms of more data that they have put out, they say that the BA2 is possibly more transmissible than the original BA1, just to underscore that both of them are Omicron and considered as such. So we continue doing the measures that we have in place, which, again, they haven't shown, they're looking at data to consider whether it will be prone to more severe disease as well as prone to reinfection, and that data is not concluded in terms of the look from WHO side. In the meantime, I think we continue doing our public health measures as we have in force, which work against this particular variant of concern, albeit a little more transmissible, as well as others. And in the face of what is considered, BA2 is considered just in terms of a name as a stealth, Omicron stealth, meaning that it evades certain things in terms of the types of detection from sequencing, that we have to be very vigilant in terms of our masking and really don't look at someone and think that they may not be infectious. We have to pretend as if everyone is carrying the virus at all points, especially with the large amount of asymptomatic spread, and the masking is a very good place to start, together with maintaining all the other 3 Ws.
Urvashi, I really want to congratulate you and thank you for raising that issue, because this headline, "Complacency Caused Deadly Surge," and this is an interview that Dr. Carissa Etienne did. Complacency caused deadly surge. And this is complacency by the public. And look at we are trying to vaccinate our 12 to 18 group. We got 14. That is complacency. And I just want to quote one part of what Dr. Etienne said. COVID-19 is a preventable disease. And right now, we're losing far too many lives. It's preventable. It's preventable by the public health measures, masking, washing hands, distancing as far as humanly possible, and getting vaccinated. Those are the facts. So you really touched on a very important issue. And I think we need to pay attention to exhortations like this coming from outside of Trinidad and Tobago. This is Dr. Carissa Etienne, Director of PAHO, speaking about complacency in the Americas. I urge everyone to read this particular article. Thank you very much.
And thank you, Minister. And with that, we go back to 103 FM for a follow-up question.
Hi, Minister. Just to follow up on the question of the mask mandate in private vehicles, if you'll allow me, just to put it more bluntly and respectfully, what would it take for the mask mandate, that being for private vehicles, to be removed? And how far is TNT from achieving that sort of circumstance?
Okay, so thanks. So you are asking me to look into the future. I think we must learn from other countries that try to predict when certain measures could be rolled back by certain dates. I cannot give you a date as to when any measure will be rolled back. As I always alert you, we look at that point in time to the whole myriad of metrics. What is our 7-day rolling average? Today it's 460. Yeah. Do you remember the time at March last year? It was 3. People are getting lulled into the same state of complacency, saying, well, it's 460 as compared to 1,000. But compared to 3 last year, we are in still a very dangerous place. We still look at deaths. Rolling day 7 average is 7. A lot better than 30. But 7 people, the vast majority of whom are unvaccinated with NCDs, are still dying. Those are 7 families plunged into mourning every day. That is still, in my view, unacceptably high. So there is no magic formula. We look at all the numbers and decide what added level of risk we can take in announcing the adjustment of measures. Thank you very much for asking.
Thank you very much, Minister. And with that, we go back to Newsday for a follow-up question. One follow-up question.
Yes, my follow-up question is, I wanted to know if there's been any update regarding the person who was the official who was a member of the PM's delegation to Qatar who came down with COVID. What's the status of that particular individual? And I don't know if Minister Diasing, if you've had a chance to liaise with the AG and see how he's recovering.
So thank you, Clint. So I have no information that I could share on the personal medical status of anyone, whether they're in Qatar or in Trinidad and Tobago. I have no information to share on those 2 individuals.
Thank you very much, Minister. And we do have a question from Guardian Media Limited. The Pfizer batch is expiring in less than a week. Have we found countries to donate them to? Have they gone out already? And when will they be getting a new batch?
Yeah, thanks. So we started looking for countries to accept those Pfizer doses since the early part of January. We have had no takers to date. It's too late now to donate them to anyone, and we are constantly following up for the 3rd tranche. That is the letter I sent off this morning, CMO, again, to remind the authorities that we expect the 3rd tranche in the shortest possible space of time. So that's where we are with the 3rd tranche of the Pfizer vaccines for the population 12 and above.
Thank you, Minister. And we do have a question coming in from Matt. Mm-hmm. We've seen during the pandemic different levels of organization and planning across different RHAs to varying degrees of success. Is the current RHA system still viable, or should there be a return to a universal system?
Okay. Yeah. So it wasn't necessarily different levels of planning across the 5 RHAs. All 5 RHAs were responsible for varying mixes of patient acuity ratios. So, for instance, the Couva facility, which the report speaks about, was that facility dedicated to the most severely ill. So obviously, North Central RHA will have a different planning process as opposed to Eastern, that didn't have to cater for the most severely ill, that didn't have to cater, like North Central, for the highest number of ICU and HDU beds. So it's not that the RHAs were planning differently, where you're trying to plan the same. Because of the necessity of the types of patients they were dealing with, there will be an adjustment in how they plan. So Northwest RHA, their level of planning was different again. The RHA that had the most acute cases would have been North Central, because under North Central you had the Couva facility, you had the Arima facility, you had Cora. 3 facilities dedicated to very often the most severe cases. So it is that would give the impression that they were not planning efficiently because they were not planning the same. They weren't planning the same because they were called upon to mount different types of responses. Okay? Thank you very much.
Thanks, Minister. And I see a final question coming in from Priya Bihari, azpnews.com.
Yes, good morning. Just a follow-up again. Minister, I've been asking to find out, what types of vaccines that have been administered. I think there are over 700,000 people who have been fully vaccinated, and 130,000 who have received boosters. I just want to get an idea about, like, in terms of the types of vaccines. How many are Sinopharm, how many J&J, etc. Can you get that? Thank you.
So the CMO is looking to that, but prior, as we have constantly said, the Sinopharm is by far the most used and most popular vaccine in Trinidad and Tobago, followed by the other brands.
Yeah, we can get the exact numbers.
Yeah.
Right. Thank you very much. Ladies and gentlemen, we have come to the end of today's media conference. Please remember that we must all work together to reduce the spread of COVID-19 and its variants. We can all do our part by making the responsible decision to follow the health guidelines, wearing our masks, washing our hands, social distancing, and of course, getting vaccinated, and if you can't, get boosted. Let's do our part to go back to the old-time days. Today we leave you with 2 video testimonials of COVID-19 survivors who regretted not taking the vaccine.
My name is Winston Murray, husband, a father, and I'm also a COVID-19 survivor. On the 8th of August 2021, I contracted COVID-19. One of the scariest parts in the hospital to me was seeing people that I would have conversed with